Hi everyone, I am Dr. Viji Prasad C, Associate Professor, Department of Psychiatric Nursing, Yenepoya Nursing College. Today I am going to discuss regarding Understanding Schizophrenia, a closer look at symptoms. First, we can see the specific learning objectives. At the end of the class, the students will define schizophrenia, enlist the types of schizophrenia, list clinical features of schizophrenia, list 4 A's in schizophrenia, and explain positive and negative symptoms of schizophrenia. Introduction. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. It is a psychotic disorder. It is caused by a combination of biological, social, and psychological factors. Biological in terms of genetic factors or biochemical factors. Social and psychological factors in that the environment where the person strained interpersonal relationship, socioeconomic factors. These are the causes. It's important to recognize the symptoms of schizophrenia and seek help as early as possible. People with schizophrenia usually diagnosed between the ages of 16 and 30 for the first episode of psychosis. Definition of schizophrenia: a group of disorders manifested by characteristic disturbance of thinking, mood, and behavior. This definition is given by American Psychiatric Association 2000. Schizophrenia is a mental disorder characterized by disintegration of thought process and of emotional responsiveness. Here we can see that the disturbance of the thought process and the affect of the person will happen. Schizophrenia, another definition: schizophrenia is not a disease of brain but a heterogeneous disorder with some common features including thought disturbances, preoccupation with frightening inner experiences, affect disturbances, behavior or social disturbances. Kaplan and Sadok, 1996. Next we can see what are the common types of schizophrenia. Schizophrenia types, it is explained in F chapter 20 to 29. First types of schizophrenia is paranoid schizophrenia. Second one is hebephrenic schizophrenia. Next is catatonic schizophrenia, undifferentiated schizophrenia, post-schizophrenic depression, residual schizophrenia, symbol schizophrenia, other schizophrenia, and schizophrenia unspecified. So here we can see the different types, and we can identify each type of schizophrenia by understanding the symptoms. What are the clinical features of schizophrenia? The Eugene Bleuler has coined the term schizophrenia. The schizo means split and phren means mind. According to Eugene Bleuler, the clinical features are classified into primary symptoms and secondary symptoms. First, we can see what are the primary symptoms of schizophrenia. Primary symptoms of schizophrenia is otherwise called as 4 A's in schizophrenia. First one, association disturbance or looseness. We can see the picture in that a healthy person, when he or she speaks, how the association or connection in that with the thoughts or affects we can see here. And when the patient with schizophrenia, when they talk about something, because their thoughts and speech may be affected, so that logical connection may not be there in that. That is association disturbances. Some of the terminologies we can see under association disturbances, like loosening of association. Thoughts, the idea shifted from one to another idea, which is entirely unrelated way. And next is clang association, that is when we listen to the person, we may feel like what he is telling or she is telling, it is having some meaning, like only rhyming and punning will be there. Example like lying, buying, jaying, dying, sighing, like that we may feel some meaning is there but no meaning at all. Another one is flight of ideas coming under association disturbances. Here we can say the ideas shifting from one to other idea, but some connections can be seen and the listener or the examiner is able to understand what person is talk about. Next is autistic behavior. Here autistic behavior means we can say that the thoughts and speech is affected, the impairment in the cognitive functions, and person will be socially isolated or withdrawn. Next is affective disturbances. In affective disturbances, we can say that the mood and affect of a person. So affective disturbance, example, flattened affect. The person may not be able to express what is exact emotions of the person. Next one is, we can call it as blunted affect. This flattened affect and blunted affect are the most important affect disturbances we can see in schizophrenia. Blunted affect, when the person express the emotions, they are not able to express the severity of the emotions exactly as it is. Next one is ambivalence, that we can see even in the pictures. I have given that picture regarding ambivalence, that is two opposing impulses occurs in a person regarding the same thing in the same person at the same time. That is called as ambivalence. Contradictory impulses will happen. That is regarding 4A's in schizophrenia. Next one is secondary symptoms. In secondary symptoms, first we can see about the disorders of perception. Under disorders of perception, we can see hallucinations and illusion. But in schizophrenia, hallucinations are more common. Here we can see different types of hallucinations. What is hallucination? First we can see it is misinterpretation without stimuli. So auditory hallucination, visual hallucination, tactile hallucination and gustatory hallucinations are different types of hallucinations. In this, auditory hallucinations are very common in schizophrenia. Auditory means patient is able to hear some voices. Maybe sometimes they feel like someone, the person who is already died, but they are talking something to the person. Next is visual hallucination. Sometimes person may tell, I am able to see Jesus Christ or Lord Krishna. When I am alone, he comes and talk to me. So that auditory and visual hallucination. Tactile, the person may feel something crawling over the body, and one of the patients expressed that I am Lord Shiva and I can feel that snake is crawling around my neck. This is an example for tactile hallucination. It is otherwise called as haptic hallucination. Gustatory means some abnormal taste will come in the person's mouth. Illusions are not common. Next, secondary symptoms are disorders of thought. We can see delusion. Delusion is a false fixed belief. So it is, we can say that that thoughts are not having any connection to reality, and when it is, we have to see that whether these thoughts are connected to the intelligence and the cultural background of the person. One more thing I want to say here in the delusion, that we can't give any reasons to remove the thoughts or the false fixed belief of the person. That is called as delusion. Different types of delusions are there. Delusions of persecution, delusion of reference, delusion of paranoid delusion, delusion of control, somatic delusion, erotomanic delusions or erotomania, and delusion of grandeur. We can see what is delusion of persecution. It is a false fixed belief that someone cheat, kill or harass me. They are planning something against me. This feeling will be there for the person. That is delusion of persecution, and it is the very common delusion we can see in schizophrenia. Next is delusion of reference. Patient may feel like somebody is referring his thoughts and feelings like that. So delusion of control, the patient having false fixed belief that someone is controlling my thoughts, my feelings and what I want to speak. The person may tell like invaders from the space, they come and they implanted some electrodes in my brain, and that electrodes are controlling my thoughts. And somatic delusion, it is related to the body. The patient may tell like my brain is rotting or melting. So erotomanic delusions or erotomania, it is most commonly seen delusion in females, and they feel false fixed belief that some other person who is in a high position, especially like example actor or a famous actor, they are deeply in love with the patient like that. That is erotomania. Next is delusion of grandeur. They may feel that they are something great and they have some power. Patient may tell I am Jesus Christ or I am Lord Krishna like that. That is example for delusion of grandeur. Other symptoms we can see in schizophrenia, disorders of motor activity. So first point is that negativism. Negativism means like a motiveless resistance towards any sort of, any attempt to move or any instructions if we are giving, patient may not respond to that. That is called as negativism. And automatism, we can see that something else is controlling the person movement or action. Then echopraxia, we can see like psychopathological imitation of the actions by any other person is doing, imitating. And stereotypic speech also coming under motor activity. Here we can see echolalia, verbigeration and mannerism. Echolalia, it is psychopathological imitation of words told by another person. And verbigeration, without any stimuli, some repetitively or persistently patient may tell something. Like one example, when patient tells like, you took all my property, I know that, I will give a case against you or sue against you. The same sentence or same phrases patient may go and tell to other people also. Next is mannerism. So mannerism, it's like involuntary movement. Sometimes repeatedly patient may touch on the earlobe always, and the patient may be shrugging the shoulder. These are the examples for mannerisms. Next, disturbance in the form of thought and speech. First one is neologism or neologism, both can be pronounced. Example, the patient may be creating some words, so we may not be able to understand what it is. So some example like food vessel instead of stomach, time vessel they may be using instead of watch or clock, and sometimes they may be combining some words like spoon and fork, it is called as pork, that name created by the patient itself. Next one is incoherence. Incoherence means we can say that we are not able to understand what patient exactly talk about. It may be like word salad, it may be like glossolalia, we are not able to understand. Next is loosening of association. Here the thoughts and speech will be not having any connection, shifting that ideas from one to another, but it is in an entirely unrelated way the talk may happen. Thought blocking. So it is sudden interruption in the train of thought and patient is not able to continue with that thought once that interruption happened. Next one is disturbance in attention. So here we can see that distractibility. The patient attention may be gone immediately to unrelated things or unimportant events or situations. Selective inattention means it is the person will try to avoid some situations or the events which may cause anxiety or tension for the person. These are the disturbance of form of thought and speech. Next we can see what are the Schneider's first rank symptoms. First one is thought alienation. In this thought alienation, different aspects are there. First one is thought withdrawal. We can say that the thought withdrawal means patient feel that someone else taken his or her thoughts from his mind. And thought insertion means somebody's thoughts or somebody's ideas are put into my brain. So what I am speaking, it's not my own thoughts or ideas. Next is thought broadcasting. The patient may feel that my thoughts and ideas broadcasted into the environment or the air by other person. It may be through TV or radio. It is continuing the Schneider's first rank symptoms. Next point is that hallucination. Under hallucinations, patient may feel that audible thoughts in their mind and they can hear some voices are arguing about his thoughts or his ideas, and sometimes the person may feel that voices are commenting on his or her own actions. Whatever actions or act the person is doing, some other voices are commenting about that. Next is passivity phenomenon. It is exactly similar like we can say the delusion of control, the experience of feelings or thoughts or ideas imposed by another person. That is, the person may feel two people are arguing about my thoughts and two people are sitting in my brain and they're always arguing or talking about, I can feel that, I can hear that. That is passivity phenomenon. Next we can see that what are the positive symptoms and what are the negative symptoms of schizophrenia. First of all, positive symptoms, it is hallucination, that is false perception. Delusions, hallucinations and delusions we have seen already different types, And next is disorganized thinking. So disorganized thinking, we can say that disorders of form and flow and stream of thought. There we can see what are the terminologies. Here we can say the patient is having tangentiality, circumstantiality, incoherent talk. So tangentiality means person is not able to come to the exact point when patient, some examiners asking some questions. Patient may not be able to come to the point. They move away from that talk. That is tangentiality. Circumstantiality means we can say like beating around the bush. At last the person come to the conclusion that what need to be talked. Next is the disorganized or bizarre behavior. Here we can see that the patient may be withdrawn, social withdrawal, decreased speech, poverty of thought, poverty of content of speech, and the patient may be having some sort of impulsiveness, sometimes will be restless. These are disorganized or bizarre behavior coming under positive symptoms. Next we can see that negative symptoms like apathy, anhedonia, avolition, alogia, blunted affect and social withdrawal. And we can see some pictures also here. Alogia, that means that decreased speech output, very less they may be speaking. If we ask something, we may not get from the content from the person. Next is apathy, that is absent, A plus padi, absence of or nearly absence of emotions. We can't make out what emotions patient is having. Next is avolition. Avolition means patient is have a lack of goal directed actions and they may be having lack of motivation. That is called as avolition. Next is anhedonia. It is loss of interest in doing pleasurable activities. The activities which is given pleasure earlier, now when patient is doing that activity, not having interest to do that activities. Nowadays activities of daily living also included in that. When patient is not having interest to do daily activities also, it is called as anhedonia. And next is blunted affect. We can say that the emotional feelings may be blunted. They are not able to express exact severity of their emotions. And social withdrawal, they will be withdrawing, they may be interested, not having interest to interact with others. That is about negative symptoms. The summary of today's topic. Till now we discussed about the definition of schizophrenia, what are the types of schizophrenia like paranoid schizophrenia, catatonic schizophrenia, hebephrenic schizophrenia, residual schizophrenia, other schizophrenia, schizophrenia unspecified, and we have seen in detail regarding what are the clinical features or what are the symptoms of schizophrenia. We can see like primary and secondary symptoms and disturbance in motor activity, disturbance in thought, disturbance in speech and affect or emotions, and we have seen about what are the Schneider's first rank symptoms and positive and negative symptoms. And I want to say that what are the core symptoms of schizophrenia: positive symptoms, negative symptoms, and we can say like impairment in the cognitive function, that is called as cognitive symptoms. Patient may be having confusion, impaired memory, patient is not able to perform that executive functioning capacities. These are the core symptoms of schizophrenia. Conclusion: schizophrenia is a severe chronic disorder that affects how a person behaves, thinks, feels and acts. It can exhibit both positive and negative symptoms. We can say antipsychotic drugs, psychopharmacology will help to reduce the symptoms of the patients. Along with that, some sort of psychosocial interventions will be helpful to reduce the symptoms of the patient and they can lead an independent life in the society or in the community. So cognitive behavioral therapy or supportive psychotherapy may reduce the symptoms and enhance their functions. Other treatments are aimed at reducing stress, supporting employment and improve the social skills of the patients. Thank you.